Hi, everyone, and welcome back to today's discussion, which is hypoglycemia, which is a low blood glucose level, typically less than 70. Some patients, however, don't experience signs and symptoms until it gets less than 60. Now, hypoglycemia occurs when a client with diabetes is not eating at all and continues to take their insulin or their oral anti-diabetic medication. Another reason is not eating enough calories to compensate for their glucose lowering medications, such as their insulin or oral anti-diabetic medication. Or it could be the result of exercising more than usual, which lowers the blood sugar anyway. Consumption of alcohol can also lower the blood sugar. So the symptoms of hypoglycemia vary depending on the degree of hypoglycemia the individual is feeling and what type of insulin or oral medication they took. But typically, the signs and symptoms include tachycardia, weakness, headache, nausea, drowsiness, nervousness, hunger, tremors, malaise, and excessive perspiration, also known as diaphoresis. Now, some may have personality or behavioral changes. Some may become confused and even dizzy at times. So, if hypoglycemia is not corrected, symptoms can progress. And when those symptoms progress, they may have double vision, and if left untreated, the client can become unconscious and they can even have a seizure from that low blood sugar. So you're going to diagnose the hypoglycemia the same as you do hyperglycemia, and that's going to be just doing a blood sugar level. Just do an AccuCheck, get that blood sugar level and see what it is. How we manage it, well, it depends on the level of consciousness of the patient. So typically, if the client is awake, we're going to give them at least 15 grams of a simple carbohydrate as soon as possible, like some orange juice. So we're going to give them something to drink. However, if the client is unconscious, then we have to use some glucose gel. And you're just going to apply that inside the mouth, in the buccal cavity of the mouth is where you're going to apply that gel. And sometimes it may even come in a tablet. And you just slip that into the side of the mouth and it rapidly dissolves. If they don't respond after any of these treatments, you may give some glucagon, which you can give IM or sub-Q or IV. If that's not available, you may give D50, 50% dextrose IV immediately. Once the client arouses and once they become alert, and they have a positive gag reflex, you're going to give them more of a complex carbohydrate, such as graham crackers and milk, and that will help level out that blood sugar until their next meal. And typically, you're going to see hypoglycemia in the hospital. So you're probably going to see this in the hospital. In your book, on page 943, there is an excellent step-by-step process on what the nurse can do to prevent hypoglycemia. So these are some things that you need to keep in mind whenever you're in the hospital caring for clients, or even in a long-term care facility such as a nursing home, or even if you work in a clinic or doctor's office and a patient comes in experiencing hypoglycemia. So you must ensure that the meal is served within 15 minutes of administering a rapid acting insulin and within 30 minutes of giving short acting insulin. Ensure that the client eats the prescribed diet and between meal snacks. Now, a client can have a snack at bedtime. If they receive insulin at bedtime, you need to make sure they get a snack at bedtime. Inform the physician immediately if the client has any nausea, vomiting, or diarrhea, or if the client refuses to eat, because you don't want to give that insulin or that oral anti-diabetic medication if the client is not able to eat, because if you do, they're going to have hypoglycemia. Administer the correct type and dose of insulin at the prescribed times. So make sure that you are double checking, triple checking that insulin and that order for that insulin. Make sure that you are checking it, and make sure you give the proper amount. And always ask a colleague to check the label of the insulin vial as well as the number of units on the syringe. That's so you can avoid any medication error. So just keep those in mind whenever you are giving your medications. Also in the book, there's a table. It's table 51-4, characteristics of hyper and hypoglycemia. This is an excellent table to look at so that you can see the differences between the two. And that ends our discussion for hypoglycemia.